Welcome to the Livelong Podcast, where your health is your power. I'm Rachel Lehmann-Haupt, your host. Today we have a very special guest, Somi Javaid, who is a board-certified OBGYN and founder of HerMD, a sexual health platform built to close the gender gap. Welcome, Somi.
Rachel, it's so good to be here. I'm so excited.
Yeah, it's great. And I'm so excited because we've met before in person and now we can talk a little bit about your story live here for our audience. So let's just start with HerMD. What was the problem that you were trying to solve when you founded it?
Oh my God, that healthcare was in an absolute mess. That women were suffering, dying, and facing delays in diagnosis because of our broken healthcare system. So I thought I was gonna take that on and change the world.
I mean, practically, what were you seeing in your practice?
I was seeing women who were in menopause or post-cancer or struggling with sexual pain or low libido, hot flashes, night sweats, and just being told to grin and bear it, or welcome to the space of your life, or I can't get my wife interested in sex. How am I supposed to help you? So women absolutely decimated, but also just not getting any real education or evidence-based solutions for multiple life phases. And it was because doctors weren't educated in those areas. And because we have no sensitivity training, there's no real female leadership, there's no funding, there was lack of data. And then there was the world's largest misinformation campaign following the press release after the WHI study. So women were afraid of their own bodies, afraid of their own hormones. So there was so much to fix that I decided to quit my job, buy a building, and open a practice so that women could get the care that they deserved.
That's incredible. You tell a story, you've told a story before about your dad, and he
Mm.
gave you some really amazing advice. He was an immigrant from Pakistan to America,
Yeah.
and he said, if no one opens a door for you, build your own door. You want to tell us a
Yeah.
little bit about that story?
Yeah. He actually was kind of upset with me and said, build your own damn door. I was really, really frustrated. I felt like, Rachel, I felt like an absolute failure. Here I was, a doctor, and I felt like I was failing my patients. I felt like I was failing my children because I wasn't home. And
Ooh, what happened?
because I just was working and working and working and not giving women these solutions, right? And I wasn't trained in menopause and sexual health. And so I was a great surgeon and I was delivering babies, but I still wasn't fixing their problem. And as a surgeon, I wanted to fix the problem. And so I went home to my husband and I said that I'm either going to practice medicine the way that I deserve, frankly, and the way that women deserve, or I'm going to quit. And he was like, oh God, woman, you'll drive us all bananas. And then I talked to my father about feeling like this square peg in a round hole because people would just say to me, well, this is the way medicine is. There's nothing you can do about it. And I was like, but we can do this and we can do this and we can do longer appointment times and we can learn about this. And they all thought I was crazy. And I took this business plan to all these hospitals and I presented it and I made it so professional. And everyone was basically like, never going to work. And so I told my father, and he was like, what have I taught you? If you can't, if no one opens a door for you, and you can't find an open door, then build your own damn door. And that's what I did. I cashed in my 401k, my life savings, quit my job, and started a practice in Cincinnati, Ohio, specializing in advanced gynecology, menopause, and sexual health care. Scary.
Uh, that was very personal. You told me once when we were talking, that really also sort of inspired this path, which was that when you were 8 months pregnant and on call.
Yeah. I was forced to deliver a baby. God, girl, you really want to get me crying already. Yeah, I think about that version of myself and I want to cry for her because I want to tell her that she didn't have to take it, that things could get better.
Can you
And
tell
that,
that story?
yeah, so I was admitted in preterm labor. contracting, had a fever, did not feel well. And I got a call that a woman was at the hospital and she was ready to deliver and they needed me to do the delivery. And I happened to be the one on call. I had not yet told my partners that I was hospitalized. So I called my senior partner and I said, hey, I'm admitted, I'm in preterm labor, I'm sick. Can someone else kind of take over my call? And by the way, there's a delivery that needs to be done. He said, no, you're there anyways, and you need to do this delivery. And so the nurses came into the room, got me out of my hospital gown, wrapped, disconnected my IV, wrapped it, um, helped me change into scrubs. I mean, you can imagine I'm like 8 months pregnant, go across the hall, deliver the baby, and God love those charge nurses. Everyone's obsessed with the show, The Pit now, the charge nurse,
So
those
great.
quintessential charge nurses. She has captured her essence. So she like taps on my shoulder after I deliver the baby, and I'm like sitting there and she's like, Dr. Javaid, are you not a patient across the way? And I was like, yes, I am, Tina. And she was like, well, what are you doing? And I was like, can we talk about this later? Patient like locks eyes with me and is like, oh my God, are you in labor, Dr. Gervais? And I said, yes, but we're not going to worry about me. Today's all about you. Got her cleaned up, walked out in the hallway. I remember she took we used to carry these heavy phones, took the phone off my belt, called my partner and said, do I need to call hospital legal team or are you going to take care of this? Because Dr. Gervais is a patient. She's not a provider today. But yeah, so that's how broken our system is and why women, despite having better outcomes for our patients, they're less likely to have a heart attack. They have less mortality, less complications, less hospitalization after a female provider. About 6 to 7 years after we start our career, we either go to part-time or we leave altogether because we're not healing our healers. Yeah.
Yeah, that story is a real example of how not all doctors, not all medical systems, but how many medical systems are sort of stuck in the past and don't understand. I mean, that's a really extreme story. What does the HerMD model do differently from a traditional OBGYN practice?
So I should probably update you in that HerMD got acquired and is now nationwide and joined forces with a company called Joy and Blokes, and it made headlines. But what did we do differently? I always say that one of the biggest enemies of healthcare is lack of time, right? Women have got to go in 5 to 7 minutes, tell your story, learn about your condition, get undressed, get an exam, and then ask all your questions. That's like not even a quickie. 5 to 7 minutes. How are you supposed to do that? And so longer appointment times. Currently, one doctor is trained for every 32,000 patients in the menopausal area and even less in sexual health. So longer appointment times, deeply trained providers, sensitivity training for our providers. Really, our providers didn't take call. We like offloaded it because we wanted our providers engaged, excited, happy, mission driven, and incentivized. And so that was the difference. It was a magical place where providers and patients could enjoy what true evidence-based medicine could look like. We were both telehealth and brick and mortar. We pivoted to a telehealth to be more capital efficient. But then we were acquired. I came in crossroads in December of raising more capital to take it nationwide, or a bigger company came along and said, hey, we do X, Y, and Z really well, but we love what you're doing. And you've been collecting data for 10 years and you've done it right. And you've built a school and an academy. Like we would love to, take this on. So they acquired the telehealth portion. And less than 2 months later, I sold the educational platform to a company called Encore Vita. So at the age of 50, I had two exits less than 2 months apart. So for people who tell you,
And tell
yeah,
us a little bit about the school you built, and the educational platform, because that's such a critical part of, getting all doctors, but particularly female doctors, up to speed and patients, getting the care they need.
yeah. So one of the biggest barriers to this type of healthcare is that we don't get this training in medical school or residency, and they're working on that now. But I wanted to fix what do we do with the doctors and providers who are out there now? They recorded me. I digitized how I approached this. It's all referenced. It was updated every year based on all the latest data. But basically, it was a digitized online academy with other multiple modules and algorithms of care for multiple, I don't want to say disease states, so we'll call them symptoms. Perimenopause, menopause, weight management, sexual health care, things that doctors don't learn about. Because what I learned as a doctor myself is when I went and got a CME course and came home, to operationalize it, to go from clinic to classroom or from classroom to clinic, sorry, is a big lift. And that's why a lot of healthcare innovation dies because they don't ask providers if we can uptake it into our workflow. And so basically, we gave people a hands-on manual of not only all the latest, greatest data and femtech and education, but how do you seamlessly put that into your day and not only better for you, but we showed that our outcomes were smashing the status quo, like 90 to 95% versus other interventions, which were like 60 to 75%.
So let's talk a little bit about the status quo. I mean, what symptoms do women often hear that are normal that, actually deserve proper attention? I mean, in reproductive health, in menopause, perimenopause, but in general.
Never so much have I seen such a glaring gender disparity as I have in sexual health care, where we have over 20 some medications that are FDA approved for men and only two for women. So low libido. Oh, it's part of aging. You've been married too long, or you've been with this partner too long, or it's normal, focus on other things. Pain is also dismissed and normalized. It's why endometriosis takes up to 10 years to diagnose in this country, which to me like boggles the mind. Just of note, there's a new test. It's called the ENDOM test. So it measures a couple of biochemical markers that are elevated. And so now maybe women won't have to go through surgery for diagnosis, which is amazing. And then the other thing that I was seeing really blown off is hot flashes, which really upsets me and goes back to my mom's story. So hot flashes not only negatively impact quality of life, like I get hot flashes, I can't sleep, but they can also be a warning sign. Persistent or unrelenting hot flashes can be a sign of underlying cardiovascular disease. And cardiovascular disease remains the number one killer of all more than all cancers combined. So the number one killer of women in this country, more than all cancers combined. And you know that I went into medicine because of my mom's
That's
story.
exactly what I was going to go to. I was going to say you have
Yeah.
a very personal story about your mom and cardiovascular disease, right?
Yeah, so we're in Cleveland, Ohio, which is literally right the cardiovascular mecca in this country. So when people hear this story, they always assume I was somewhere remote. But my mother, 45, Mediterranean diet, non-smoker, weeks and weeks of left arm pain, shortness of breath, chest pain. You put that into chat AI or chat GPT and they're like cardiovascular disease. But dismiss, dismiss, dismiss. Told caffeine, it's your kids stressing you out. I'm looking at this EKG, I'm pre-med going, arguing with the cardiologist saying, this is ischemia. This is like low blood flow. He's like, no, women's EKGs are different. It doesn't matter. I think not even 6 weeks later, phone rings. I'm at Northwestern, and my dad says one sentence. He's like, "Somi, you need to come home." And I knew. I either thought she had died or that something had happened. And sure enough, she was en route to emergent quadruple bypass surgery. She had coded on the cardiac catheterization table because she had such severe blockages. And when the surgeon came out, God, I still have goosebumps, Rachel, and this happened to me over 20 years ago. He said that if the heart attack would have come, she would not have survived because her widowmaker was over 95% occluded.
I have the
Um, mhm.
I mean, so how much of this is because there isn't proper data on women and, women are not small men and so therefore need to be diagnosed and treated differently? And then how much of this is also just plain old sexism in medicine where women are dismissed?
It's both. The lack of data has really, really literally killed us because they didn't know that an EKG could be, look different than it would for a man. That a woman maybe doesn't present with crushing substernal elephant on my chest. My mother was never that way. It was, yeah, my chest is hurting, my left arm is hurting, I'm
Right.
short of
Don't
breath.
complain. They don't
Yeah,
complain.
they
We're
don't complain.
taught not to complain.
Yeah,
Or
and
if we do
then
raise
there
our voice, it's considered complaining.
it's complaining. And then, yes, we are raised in this medical environment where there is a ton of harmful medical terminology. You know this. I mean, think about the word, you're a words person, hysterectomy. Like the Latin root for uterus is mitra, endometrium, myometrium. Why do we call the removal of the uterus a hysterectomy?
Because it's
Because we
supposed to end hysteria, right?
Yes, exactly. And so, lack of data, lack of funding, lack of education, lack of sensitivity training. And Rachel, despite the fact that women outnumber men in that clinical workforce with all those amazing outcomes, we are not in those decision-making seats. So, therefore, not only is cardiovascular disease the number one killer of women, more than all cancers combined, but women are more likely to die of a heart attack. And you are more likely to die if your cardiologist is a man versus a woman.
Mm.
So that is the best statistic I can give you that marries the question you asked me. So it is generational gender bias along with lack of data.
So if a woman feels dismissed by her doctor, what should she do next?
Honestly, I used to say, fight back, go in armed, find another doctor. But if people say to me, doctor, like, listen, it already took months to get in, or this is the person in my network, I say, choose the problem that is most affecting you. So use your time wisely. Go in armed with your symptoms, your questions, and any latest research that you can get your hands on. The more knowledgeable you are, and no one knows your body better than you do, by the way. I mean, I might anatomically have a little bit more knowledge, but nobody knows what's normal and not normal for you other than you. And so, really knowing that your voice matters and positioning yourself as a partner in your care and frankly, the CEO of your own body is what I tell women. That's how you need to approach your own healthcare.
Mhm.
So, being able to go for multiple visits and being flexible about that and going in very prepared. Those are my two biggest pieces of advice.
So just to conclude, Somi, what do you see as the biggest opportunity to transform women's health in the next decade?
Education. Education of providers and education of patients. Really, if we fix that gap through data and research, and advocacy, that is where we can really kind of make up for the mess that we have made in healthcare, particularly for women. So that is, and you have to make healthcare accessible. It has to be affordable.
Great. Well, thank you so much, Somi. It was great to see you. I look forward to seeing you in person. And thank you for sharing such personal stories that led you to be such a powerful revolutionary in women's health.